Well, as Italy and now the United States brace for the shutdown of schools across their countries, concern of COVID-19 is now closing in for school teachers here in the Bahamas. Bahamas Union of Teachers President Belinda Wilson says rather than wait for the possibility of a case to present itself, the union is taking proactive measures. Enlisting the insight of the Ministry of Health officials at a B.U.T training session earlier today, Wilson says the idea is to educate teachers on the circumstances surrounding the virus in the Bahamas, as well as prevention methods. Wilson also spoke to their general concerns.
If schools have to close, then it puts to the test that which the ministry has been touting since September. There's a virtual school. There are iPads and tablets and laptops that students and teachers would supposedly have received. So then we will see how the technology will be used to facilitate instruction. Now, when you talk about testing, then that's something outside of the scope, which means, again, that education will have to be creative. They may have to adjust the schedule for the examinations, not only internal examinations, but even external examinations.
Addressing union members at that workshop today was physician in the Ministry of Health Surveillance Unit, Dr. Felicia Balfour-Greenslade. Speaking to reporters at the event, Balfour-Greenslade revealed that there will soon be a health hotline in which concerned persons can call if they suspect they have come in contact with the virus.
You call in, you speak with a healthcare provider on that line. They will advise you based on the answers to your question. You'll be directed to a facility for additional assessment if needed. So if you're having a concern, you travel to an area where you know that cases have been, and this can happen on the Family Islands, it happens here, or it can happen at any private facility. All our healthcare providers are aware of this response plan. Call into your healthcare provider. Let them know what your concerns are, simply because we recognize that most persons are not going to need to be in hospital. We know that. A good number of persons are going to have mild disease, and we can actually tell them if you can safely quarantine at home, do that.